Welcome to Fields of Study from the Masonic Cancer Center. Today we sit down with Jared Maroney-Hernandez. Hello everyone and welcome once again to Field of Study. This is Max Huber, the Communications and Marketing Manager with the Masonic Cancer Center. In this series, we sit down with some of our faculty and staff to get to know them during this time of stay-at-home orders for Minnesota. Some of us are working in non-traditional environments. A lot of us have had to change how we go about our day-to-day operations. And one of those people that I'm pleased to interview today is Jared Maroney-Hernandez. He is a clinical research coordinator with our clinical trials office at the Masonic Cancer Center. Jared, thank you so much for joining me.
Hi, Max. Yeah, happy to talk with you today.
Yeah, how are things going for you in your role? Maybe things have changed on a day-to-day process, but just if kind of walk us through what maybe has gone different for you.
How things kind of look different. Well, first of all, I'm working from home for the most part, but whenever I have any of the participants in these trials come into the office, the clinic rather, when they come in, then if they have to be seen, like if for safety purposes or an assessment or anything like that, then I go and see them. But primarily, we're trying to keep track of them remotely when we can, just so we can introduce one less complication or interaction, with the patient who is kind of vulnerable right now. So, yeah, it's just kind of coming up with all these different, approaches and trying to be really thoughtful in how we engage with the participants and make sure we still give them the proper support that they need, given the time, with all the reduced operations and all of that. So I'm just trying to get creative and collaborating with all the team members and making sure that everyone is good and taken care of and feels comfortable, because it is, kind of a little nerve-wracking just kind of being out and about right now.
Yeah, and you did mention, there is maybe that telehealth or remote medicine option that's out there, but there are certain times that you and the patient, you're required to be in a room together in close proximity. You mentioned, just the mindfulness of that. What precautions are you taking as a frontline staff worker right now?
Yeah, so I guess the way that I try to approach it is consider, like, given the fact that I, have to at times be in personal contact with people who are vulnerable at this time, I try to consider myself an extension of the high-risk group, just because by nature of me being near them. So when I'm not working or anything like that, I'm doing everything that I can to, social distance, to wash my hands. If I have to leave the house, whenever I come back, I immediately go to the, take a shower and, change my clothes, and I'm got the laundry going. I actually just finished up a little bit ago. So, I have, luckily, we were given some masks from some volunteer groups and stuff like that. So I have enough to kind of rotate and also just make sure that those are clean. But just really trying to take care of myself in the meantime, because I know that, if I'm taking proper precautions, then I'm not adding undue, risk when we need to be seeing the patients face to face.
Yeah, and just from a personal perspective, you've maybe had to, we've obviously had to make some personal social changes in our environments, but you're working with a group that you mentioned maybe a little immunocompromised, depleted immune systems. So have you taken even extra precautions? You said you're an extension of this sector. Are you pretty much just staying at home and doing your thing?
Actually, so if I would say before, I would probably spend maybe 60% of my time in the clinic, running around, finding patients and kind of keeping track of them as well. But right now, I'd probably say it's probably much closer to maybe 10-20%, basically only if it's absolutely necessary. As much as, I enjoy, spending time with my participants and stuff like that, especially, even going to the cancer center and stuff like that with the precautions that they have in place, just making sure without having, visitors and stuff like that, it just, you can tell that things are just very different. And I guess still trying to keep things light and still trying to be like a person of contact and support and, education and all of that. So I guess just trying to be creative with how we approach that. So I'm finding myself doing a lot more phone calls with the patients and kind of checking in with them and seeing, and seeing what kind of practices they're doing to keep themselves safe, I guess I just try to fill in this space where I can just really be there for the patients, even if I'm not there, kind of thing. So.
Yes, there's kind of a silver lining with this whole thing in the fact that we are in a technologically modern age where we are able to do Zoom meetings and Skype check-ins with people, and even on the phone. You hop back to 1918 with the Spanish flu pandemic, not even an option. Where now you and some of our doctors and other nurses, you're actually able to connect with these people, like you mentioned, on the phone, or if you want to have a face-to-face conversation like we are, you hop on a Zoom meeting and you can have this. It doesn't provide the exact personal touch, but at least you're able to see someone's face and have a conversation.
Yeah, and luckily for the most part, all of the participants that I'm currently coordinating their care, we have already an established relationship. So I can imagine kind of starting that out right now might be a little difficult because a lot of times, people when we first start out are a little more nervous and just need a lot more guidance and support and that kind of thing. But in the meantime, it feels more like, checking in with people. And I'm really grateful for the ability to provide some monitoring even without, adding that extra risk during this time.
Yeah, well, we're grateful for the work that you and all your colleagues are doing. But I want to back up a little bit here and kind of go into your background. So what inspired you to be a nurse and to get into the field of really helping people get better?
Yeah, so let's move to go back to, I started out in school, wasn't really sure what I wanted to do, so I transferred to a community college by my house, and I worked at a group home, just kind of thinking that it would just be, good work and, just something to do while I was in school, but I got to see all the stuff that the nurses got to do and, the kind of critical thinking that kind of went involved into their day-to-day practice and the kind of support and education that they got to do. So eventually that kind of led me to go into nursing school. So during nursing school, I was a nursing assistant at the local hospital up in Fargo there. And so I got to work in all the different units, kind of figure out what I wanted to kind of, which direction I wanted to go when I was a nurse. And then I always found myself in oncology. I thought it was just an excellent opportunity to serve people that, have, very, just a wide range of experiences and, where they are in their spectrum with respect to, their lives and stuff like that. So I think I'm just very excited and energized by, learning as much information as I can so that I can provide that to people so that they can, make the most full, the best decisions for themselves and how to, take care of themselves in the meantime. I think I'm not really one to shy away from, from hard situations because, people have to go through them either way. And I feel very called to kind of provide that kind of support for, for people living with cancer.
Yeah, and a lot of these people are looking for that support. And so for you to be kind of an oak tree for them that they can lean on is great. For those that might not know, what does a clinical research coordinator do? We know that you see patients, but that title might not resonate with some people.
Sure. Yeah. So as a clinical research coordinator RN, so I currently coordinate all the breast cancer trials at through the clinical trials office. So basically what that entails is I'm more of a clinical facing position. So the treating physicians will kind of let me know when they've identified someone who may benefit from one of our clinical trials. And then I just go over, introduce myself, kind of tell them, what my role is, and kind of talk a little bit more about those clinical trials and what their aims are, and kind of help them decide, whether or not those goals are in line with what they feel would be best for moving forward with their treatment plan. And so going from there, educating, doing informed consent, putting them on the trials, and then I'm kind of responsible for, these trials. They have very, very specific protocols that we follow in terms of, what needs to be ordered and, when things need to occur and, visits and labs and scans and all, everything that's involved. So pretty much if it's within dictated by the protocol, then I'm the one who makes sure that gets ordered, make sure that, the appointments are made. And then I'm a big part of like just kind of maintaining that relationship and kind of following them and tracking, how are they responding to the treatment, not just necessarily with we're focused on like what's, what kind of adverse events are happening and, when they're resolved, what they use to do better. But really it's just, just kind of seeing how are they as a person responding to this treatment, and then kind of translating that into, the research language and sending out to the sponsors so that, because we're treating patients in front of us, but we're also, treating future patients by, trying to pave path for more individualized treatments in the future. So I think that's the exciting thing for me. So it's a lot of patient-facing responsibilities, but also, I'm constantly talking with industry sponsors and following up with them and making sure that, the data that we are providing them is good and meaningful and robust. And so I just, it's a fun challenge for me to just kind of live in this very central world that involves so many different kind of pieces, and it has it's very meaningful work to me. So
yeah, and a lot of people they hear about these drugs and they're like, well, why can't this just go from the idea to the market like this? And that's what clinical trials are for, to, whether it's phase 1, phase 2, phase 3, to test these on a certain group of people that they feel that this trial would fit for. And it's very imperative that you take these proper steps. Yes, this might be the wonder drug and people feel like this is going to be the next big thing, but we also want to make sure that there's no side effects to see what the exact outcomes are. Is this actually treating what we're doing? And sitting down with, you mentioned breast cancer, Dr. Yee, the director of the Masonic Cancer Center, who's a breast cancer oncologist, just picking his brain every now and again to talk about this whole process. It's super interesting. And so for you, you mentioned working with not only the doctors, but the sponsors. It's a very important job, and there's just got to be a lot involved with it.
Yeah, yes, along that same vein, I think that you, just kind of hit the nail on the head with, there is, this, a frustration with, if something is available that can work right now, why isn't it available right now? And I think, as people who work in the oncology world and support on, patients who are living with cancer, I think what we want more than anything else is patient safety. And, and we want to give support and, help do that in any way that we can. But I think it's also a part of our approach is also making sure, that we understand the benefits, but we also understand the risks. So I don't believe that people can make proper treatment or, basically life decisions without having, the most information available to them to make sure, okay, well, yes, this is a very promising looking treatment, but also balancing that with the risks involved with that. And I just like being a part of the team that gathers all of that information.
Yeah, and you talked about patient safety, and even now more than ever with the immunocompromised patients that we're seeing, it's even more imperative. Some of them are seeing home infusions. Some of them are putting off their actual doctor visits and having telemedicine. So you mentioned it, and it's one of these things that even now we're adapting and taking a different approach to it, but it's still one of the first things in people's minds. I do want to back up a little bit, a couple more questions. You did mention Fargo, and being someone that lived in North Dakota for a while. What was your connection to Fargo?
So when I was in school, so I'm a big nerd, and I just love, learning and doing pretty much as much as I can. I mean, I studied ancient Greek when I was in college. I mean, I studied music. I call myself a recovering music minor, and all these other things. So I went to Concordia College up there in Moorhead, and I was in the music program up there. As I was taking all kinds of history classes, psychology classes, economics. Like I just really enjoy learning and gathering as much information, just because like I said, I'm a big nerd, and I think that stuff is fun. So once I I was in the Concordia choir while I was there, and then I graduated and just kind of continued working up there for a couple of years. And then my wife, then my fiance, went to the University of Minnesota for grad school. And I'm originally from the Twin Cities, northwest suburbs, and she's from the northwest corner of Montana. So I'm excited that I get to stay here, and she really enjoys it and enjoys her work. So yeah.
Nice. And every cobber I've ever met, I never had an issue with them. So I was an hour north in Grand Forks, but
okay.
We all end up here. And the one thing I always like to end this on, and every time I mention this question, it's a very loaded question, but you've talked about a lot of things that I think personally give me hope for the trajectory we're taking. So in today's environment, whether it's something personally, professionally, whatever it is, what gives you hope?
I think just being around so many hardworking, smart, passionate people. I think if nothing else during this time, even though I don't see people as often, like physically, like I said, we're still having like these Zoom meetings and talking to all these people. And I just really, I feel like everybody, even though things are, really changed, we're all trying to figure out, how we are going to approach things. And, there's a lot of the insecurity that's involved there. But what hasn't changed really is that people still have that goal, and they, come to work ready to, just to contribute. And I think that's just something that I really appreciate being a part of.
That's awesome. Well, thank you so much for all that you're doing, all that your colleagues are doing. Stay safe. And thank you so much for joining us, Jared. This was great. I really appreciate it.
Yeah, thank you very much for having me. This was a nice break in my day.
Perfect. If check us out next time, we'll have some more editions of Fields of Study here from the Masonic Cancer Center. We'll see you next time.